Hello and welcome to an RCSI Sim model making guide. In this video we are going to cover the entire process of making an abdominal incision and closure pad, which will be demonstrated by senior technician and developer of the model, Adam F. Roach. Let's get into it. Firstly, it is important to make sure your surface area is nice and clean before pouring any materials on it. You want to make sure there is no dust or particles on the surface that will interfere with the latex or silicone. Adam does a great job here getting the table squeaky clean with some disinfectant and wipes. You want to make sure the table is bone dry after also. As smooth a surface as possible is recommended, as any major divots or deep scratches will transfer to the poured material. PPE is highly advised when working with these materials. If liquid latex gets on your clothes, forget about ever wearing them again. Also, be sure to not to wear latex gloves when pouring silicone, as any contact made will inhibit the silicone from curing properly. A solid precautionary measure is to tape around all of the edges of your pouring surface to prevent any spilling of materials onto the floor. The next step is to quickly measure out the number of pads we intend to pour for using the abdominal jig. We're going for 10 pads here, so Adam marks that out in a 5x2 fashion using a dry white marker. We then cut our foam, which represents the fatty subcutaneous layer, to the same dimensions. We are now going to pour the liquid latex onto the table, which represents the skin layer. A measuring jug and a spatula of sorts are also used here. The ammonia tends to sink to the bottom of the bottle, so a good shake is recommended before pouring it into the jug. We now fill the jug with about 800 ml of liquid latex. This should be ideal for 10 pads. Give the latex a good mix with the spatula to make sure the ammonia is evenly dispersed in the liquid. A figure of 8 mixing motion helps avoid bringing too much air into the latex. Don't worry about a few air bubbles, these will be removed after pouring. We are now going to pour the liquid latex evenly across our marked area. It's worth mentioning that liquid latex has a potent aroma, and if you are pouring it in a poorly ventilated room, then you should definitely consider wearing some sort of face mask and getting out of there once the pour is complete. We have the luxury of a large, well-ventilated lab at our disposal, but in cases where a small room is being used for the pour, we would highly recommend keeping it vacant for the duration of the drying, which is about 48 hours. Adam is now using the tip of the spatula to eliminate some air bubbles and spread the edges out a bit. He just does this briefly as he's about to whip out the secret weapon, the hairdryer. This makes the bubble elimination process a million times easier and also ensures a nice even spread of the liquid. You can of course achieve the same end product with the spatula, but you'll be there all day. So Adam will still use the spatula to shape the edges, but it's the baby-less that does the lion's share of the work. With our liquid latex spread smoothly and evenly, we don't waste any time and place the foam on top of it right away. You want the latex as fresh as possible so it absorbs into the foam, as the drying process begins as soon as the latex leaves the bottle. Onto the silicone. The type of silicone we use for the peritoneum layer is a 0010 EcoFlex by Smooth On. We experimented with many types of silicone, and this one replicates the strong, stretchy properties of peritoneum far better than any others that we tried. We are pouring 800 ml of silicone, which should cover a similar area as the latex and foam. The EcoFlex is mixed 1:1 part A and B. Other silicones may require different ratios, so be sure to consult the data sheet before mixing. It's very important not to let any of either part come in contact with the other in their containers, as this will render them useless, so be sure to close each lid immediately after pouring. Adam deftly pours 400 ml of part A before moving on to part B. As this is a relatively large amount of silicone, this can be measured roughly using the jug. For smaller amounts, however, a weighing scale is recommended. Silicone begins to cure as soon as the two parts make contact with each other, so it's important to stir the mixture well right away. A figure of 8 motion, like we did with the latex, does the job again, being careful not to introduce air to the mixture, as air bubbles are very difficult to remove from silicone once it begins to cure. A couple of minutes of mixing like this should achieve the desired consistency. Wasting no time, the mixture is then poured over the table, matching the coverage area of the latex and foam. The pouring technique Adam uses here is akin to dressing a hot dog, and it works well to achieve an even dispersion of the mixture, which is then smoothed out evenly with the spatula. The key to replicating peritoneum accurately is to spread the silicone as thinly as you can manage, ideally about 1 to 2 mils thick. The EcoFlex takes 4 hours to fully cure, but we are going to leave it for 48 along with the latex. Our silicone is cured beautifully, so we are now going to use the jig to measure out a section of peritoneum layer. If you are making numerous pads, then it would make the most sense to mark out the entire sheet of silicone. We are just doing the one here for the purpose of the video. We now cut out the section with the scalpel. 10 blade does the job well. If you are worried about scratching your pouring surface, then it may be a better idea to pull up the whole sheet after marking it and then using a scissors to cut out the sections. However, if scratches aren't an issue, then this method is a lot handier. It's not essential for the sections to be bang on the dimensions of the jig, they just need to cover the hole in the middle where the laparotomy incision is made. Next, we will pull up our latex and foam layer. A full 48 hours have passed since the pour, so there should not be any worry of the latex remaining wet. Not too shabby, overall a nice smooth finish with some small rougher areas where bits of latex stuck to the table. This is no issue really, as the rougher parts can be lined up with the peripheries of the pad and will barely even make an aesthetic difference. Mixing the liquid latex thoroughly is key to achieving a result like this. If the ammonia is not properly mixed in, then you see small holes everywhere in your pour. Again, we mark out a pad using the jig. You can also get away with using some of the unpainted foam at the edges, as it will be covered by the edges of the box. A scissors is the best option for cutting out this layer. Don't worry about cutting it perfectly even. It can be trimmed appropriately against the box, which Adam will demonstrate next. Just the one little slice is necessary in this instance. You don't need to be overly concerned about precise dimensions here either. Once the pad fits comfortably onto the 4 plugs here, then you're in business. The final layer that we need to prepare is the linea alba, the midline connective tissue of your abdominal muscles. This is a white silicone sponge with a shore hardness of 15, purchased in rolls, and simply needs to be cut to size using the same method as the other layers. We're now going to briefly demonstrate how easy it is to clean the jugs once the materials have dried. Larger pieces of latex like this can be ripped out first before using a wipe to remove the lighter splashes. For the silicone, everything can be just pulled out handily enough. Always wait for your materials to dry/cure before cleaning them off your equipment, as it'll save you a lot of hassle. So we are now ready to assemble our pad. To stick the linea alba to the subcutaneous layer, the silicone adhesive Silpoxy is used. Then, for gluing the silicone peritoneum to the linea alba, a silicone sealant is required. To apply the Silpoxy to the subcutaneous layer, don gloves and squeeze a dollop onto your finger and spread like so. We only want to cover the perimeter of the pad with adhesive, as we want the individual layers to be separable when the midline incision is made, as is the case with human anatomy. Once the Silpoxy has been applied, simply pat down the linea alba layer like so, and we can then move on to the peritoneum. To attach the peritoneum, we essentially do the exact same thing as we did for the previous layer, but instead of Silpoxy, we use silicone sealant. Squeeze a nice snake of sealant out of the tube and then spread using a gloved index finger. Again, we only want to adhere to the perimeter of the layers and leave the center of the pad separable. Then simply place down the peritoneum layer and gently pat it down to make the seal. Any overhanging edges can be snipped away with the use of a scissors. And that concludes the assembly of one abdominal pad. Both silicone adhesives used take around 2 to 3 hours to set, but to be safe, we always leave the pads overnight before using them again for teaching. So it's the next day, the adhesives have set, and our pad is now ready for use. All's left is to stick it into the box/jig. There are 4 plugs at the corners of the box, which hold the pad in place. What we do is press the pad against the plugs first, leaving indentations for where holes need to be made. So once we've done that, we take a scissors and jab through all the layers of the pad and then open it out to create a suitably sized hole. This is of course repeated for each corner of the pad. And that's it, ready to be fired into the box, like so. Now, this part is optional, but with sustainability and economy in mind, we like to get 2 incisions out of each pad. So what we do is we mark out where the incisions are to be made, allowing enough space for 2, which is about 3 to 4 centimeters apart. The task is always performed in pairs anyway, so this avoids any faffing around with a new pad when the operator and assistant are switching roles. We mark out 10 centimeter lines for each incision. Last step now, I promise. A balloon is inserted into the jig to simulate the small bowel. It is not inflated much, just enough that it applies slight pressure to the underside of the pad. We typically use a pink balloon, as that would be the closest match to the colour of small bowel, but we're all out of new baby girl balloons, so purple will have to do the job today. This model is now ready for laparotomy, incision and closure. Thank you for watching, and I hope you found this video useful.